Amenorrhea. Definition: amenorrhea is the absence of a menstrual period in a woman of reproductive age. Classification of amenorrhea: 1. Primary amenorrhea. 2. Secondary amenorrhea. Primary amenorrhea, menstrual cycles never starting. May be caused by developmental problems such as the congenital absence of the uterus, failure of the ovary to receive or maintain egg cell. Secondary amenorrhea, menstrual cycles ceasing. It is defined as the absence of menses for 3 months in a woman with previously normal menstruation or 9 months for women with a history of oligomenorrhea. Causes and risk factors. Natural amenorrhea. During the normal course of life, women may experience amenorrhea for natural reasons, such as pregnancy, breastfeeding, menopause. Primary amenorrhea. There are many reasons for primary amenorrhea, including genetic and anatomical disorders, Turner syndrome, anorexia, and polycystic ovarian syndrome. Walt and Barbieri, 2016. Secondary amenorrhea may be caused by functional hypothalamic amenorrhea, pituitary disease, primary ovarian failure, pregnancy, breastfeeding, menopause. Too little body fat, about 22% required for menses. Eating disorder, thyroid disease, polycystic ovary syndrome. Walt and Barbieri, 2016. In adolescence, secondary amenorrhea can be caused by minor emotional upset related to being away from home, attending college, tension due to schoolwork, or interpersonal problem. Nutritional disturbances may also factors. Obesity can result in anovulation and subsequent amenorrhea. Medications. Certain medications can cause menstrual periods to stop, including some types of antipsychotics, cancer chemotherapy, antidepressants, blood pressure drugs, allergy medications. Lifestyle factors. Low body weight, excessive exercise, stress, hormonal imbalance. Many types of medical problems can cause hormonal imbalance, including polycystic ovary syndrome (PCOS), thyroid malfunction, pituitary tumor, premature menopause, structural problems. Problems with the sexual organs themselves also can cause amenorrhea. Example include uterine scarring, lack of reproductive organs, structural abnormality of the vagina. Signs and symptoms. The main sign of amenorrhea is the absence of menstrual periods. Depending on the cause of amenorrhea, you might experience other signs or symptoms along with the absence of period, such as milky nipple discharge, hair loss, headache, excess facial hair, pelvic pain, acne, vaginal dryness, night sweats. Diagnostic evaluation. History collection. Physical examination. Blood tests may be performed. The levels of hormones secreted by the pituitary gland, FSH, LH, TSH and prolactin, and the ovaries, estrogen. Ultrasound of the pelvis may be performed to assess the abnormalities of the genital tract or to look for polycystic ovaries. CT scan or MRI of the head may be performed to exclude pituitary and hypothalamic causes of amenorrhea. If the above tests are inconclusive, additional tests may be performed including thyroid function test, determination of prolactin levels, hysterosalpingogram, X-ray test, which examine the uterus, hysteroscopy. Management. Dopamine agonies such as bromocriptine, Parlodel, of pergolide, Permax, are effective in treating hyperprolactinemia. In most women, treatment with dopamine agonist medications restores normal ovarian endocrine function and ovulation. Hormone replacement therapy consisting of an estrogen and a progestin can be used for women in whom estrogen deficiency remains because ovarian function cannot be restored. Metformin, Glucophage is a drug that has been successfully used in women with polycystic ovary syndrome to induce ovulation. In some cases, oral contraceptives may be prescribed to restore the menstrual cycle and to provide estrogen replacement to women with amenorrhea who do not wish to become pregnant. Before administering oral contraceptives, withdrawal bleeding is included with an injection of progesterone or oral administration of 5 to 10 mg of medroxyprogesterone, Provera, for 10 days. Some pituitary and hypothalamic tumors may require surgery and, in some cases, radiation therapy. Women with intrauterine adhesions require dissolution of the scar tissue.